So my team came up with a list of 3 questions that they thought would be tough for me to answer. So we'll try my best. So if you guys don't know who I am Dr. Sam Al-Ghazawi. I am an orthopedic sports medicine surgeon in New York City. So question 1, do you ever feel pressured to recommend a surgery when other treatments might work? That's a deep question. I think the short answer is no, I don't. I understand that sometimes surgeons may get a bad rep thinking that, this is how surgeons make money. Of course, they're going to recommend the surgery because that's going to give them a bigger paycheck. For me, it's always about doing the right thing for the patient. I think pretty conservative when it comes to surgery. I think that the body's a pretty resilient thing and we can handle a lot of injury and bounce back. And so I think making sure that people have tried the conservative stuff, including physical therapy and rest and, all the things that we have at our disposal is usually my first approach. Surgery, yes, can be the right option, but very specific to the patient, the injury, and those are the patients that have the best outcome. My goal is to build trust with my patients, and I think one of the best ways to build trust is getting people better without surgery. I'm a surgeon. I love to operate. There's no question about that, but if I can make you better without a surgery, I think it's a win for both of us. Question 2, is there a surgery that I perform that I would personally like to avoid? Yes, there is definitely some trauma surgery that I perform that if I could wave a magic wand and prevent myself from having that surgery, I would definitely do it. One of them is a bad tibial plateau fracture for a couple reasons. One is it's a difficult surgery. There's a couple different structures that can be injured, and we just know that there's a higher rate of arthritis in those types of surgeries when the cartilage itself gets injured. So if I could avoid it, I would like to avoid that surgery. I mean, ultimately, I'd like to avoid all surgeries, even though I'm a surgeon, if possible. And that's why, again, I think I take the approach of trying the conservative stuff first. Last question is, how do I handle the emotional toll of working with patients in severe pain? I think it's really hard to see another human in pain, but the flip side of that is that I have the ability to bring those people out of pain, and help them in a way. So yes, it can be draining, it can be difficult and emotional when you see somebody that's in so much pain. I think that when you see those patients do well and recover and get back to sports and just living a pain-free life, you try to focus on that when you see that next person in pain. So usually I'm the one asking the tough questions, but I'm always happy to answer the tough questions. I do it every day in my job. If you like this video, or if you have some tough questions yourself, feel free to comment, like, subscribe, or send me a message directly, and I'm happy to help.